और गेस्ट आ गए सब।
We can begin, sir.
Right.
Yes.
Thank you. Yes, Nivedita.
Yes.
Mm.
Yes. Namaste all. Respected patron, president, distinguished panelist, honored guest, esteemed members of Academy of Hypnosis, colleagues, students, and friends. A very good morning to you all. It is my privilege and honor to welcome you all to the 4th Foundation Day celebration of Academy of Hypnosis India. Today is a day of celebration, gratitude, and inspiration as we commemorate 4 successful years of the Academy's commitment to promote the science and art of hypnosis and professional and ethical practice. Today is more than a celebration of another year in our journey. It's an occasion to reflect on our shared vision, acknowledge the dedication of our members, and reaffirm our commitment to advancing the science, education, and ethical practice in hypnosis in India. Since its inception, the Academy has worked hard to promote evidence-based knowledge, encourage research, foster professional excellence, and build a vibrant community of professionals, educators, and researchers. Every milestone we celebrate today is a testament to the collective efforts of all those who have contributed their time, wisdom, and support to this mission. This year's Foundation Day is especially meaningful as we come together for a thought-provoking panel discussion on hypnosis, past, present, and future. As field continues to evolve through scientific research, technological innovation, and interdisciplinary collaboration, this discussion offers an opportunity to explore new possibilities while remaining rooted in ethical and professional practices.
निवेदिता,
On behalf
आपका
of,
ऑडियो ठीक नहीं.
sorry, sir. On behalf of Academy of Hypnosis, I extend a warm welcome to our distinguished speakers and guests, Dr. Dayal Mirchandani, sir, Advisory Board Member, Neuropsychiatrist, and Hypnotherapy Expert, Dr. B.M. Palan, sir, Patron and President of AoH, Dr. Rakesh Jain, sir, Vice President of AoH, Expert of Hypnosis and author of prominent research papers and well-known books. Dr. Amita Puri, ma'am, retired associate professor, hypnotherapist with over 20 years of experience. Dr. Prasanta, sir, treasurer of AoH, clinical psychologist and hypnotherapist. And Dr. Avnish Dave, sir, general secretary of AoH. Our patron and president of AoH, Dr. B.M. Palan, sir, whose vision and leadership have been instrumental in the growth of Academy of Hypnosis India. Sir, I request you to kindly address the gathering. Dr. B.M. Palan, sir.
Thank you. So, warm welcome to all of you, colleagues, students, friends. And today I thought of reading out something These are some of the paras which I shared in the newsletter, and I thought of revising these points. So, during the first quarter of this century, two universities started hypnotherapy courses. MS University of Baroda in 2001 and Charotar University of Science and Technology in 2016. So we have by now more than 500 qualified professionals through these courses now in our country. The number might be more also, perhaps more than 500, 600 perhaps. We felt need for a pan-India academic professional body of this science for continuous education, discussion on clinical applications and research and academic endeavors. And that led to the birth of AoH, Academy of Hypnosis India, on 26th June 22. AoH is a registered pan-India professional body of qualified medical and psychology professionals interested in research and use of hypnosis in clinical practice. I'm happy to convey that the 10th batch of online postgraduate diploma course in clinical hypnosis will commence from August this year. I'm sorry for these disturbances. Perhaps it seems my net is not stable today. I hope I'm audible.
Yes, sir.
Yeah. So this course, online course we have started, especially there we have combined the Western therapeutic concepts with the Indian psychology, what we can call the Indian philosophical thoughts. And I feel that today scientific community is inclined towards learning of these concepts. While the fourth issue of AoH newsletter is being published today, I take this opportunity to request every member to work proactively towards growth of AoH, and especially I request all of you to contribute in the this newsletter. Whatever cases you are doing or whatever reading, like last month, it was a good beginning by Madhur. Something you have read, some book in hypnotherapy, you can present the review of that book also. So there are multiple ways. One is you may participate actively by attending monthly clinical meetings and presenting your cases. You may contribute your cases and articles for publication in the newsletter. You may motivate your friends and batchmates and students to join AoH, because I have observed that 50% of PGDCH and PGDCH, this is MSU course, they are yet to join AoH. So half of us, even not half, have joined. So we may motivate people, your batchmates and all. I request all of you to please take action on this. Very few of you are present here, but take action on these AoH we can have a drive to increase the membership. You can give ideas about various activities we can take up. Like in the last clinical meeting, there was suggestion during guiding members in research projects, in writing their cases or papers. I also request senior members and faculty members to motivate colleagues and students for learning and utilizing science of hypnosis. I encourage them to volunteer themselves for being faculty for AoH basic and advanced course. We were thinking that time, but now we are planning to have one postgraduate diploma kind of a course by AoH. So those who are interested, I request them to contact to give their every month we are hosting that meeting, and we have seen a very healthy discussion on case presentation. Dr. Dayal Mirchandani, Dr. Rakesh Jain, Dr. Renu Sharma, Dr. Prasanta Roy, Dr. Channa Rana, Dr. Veena, and other colleagues. So I request all of you to keep coming for clinical meetings, and that really motivate the students and junior, it's very enthusiastic therapists. So that the main purpose of academy and by contributing to the growth of these scientific science of hypnosis in our country. I am happy and satisfied with the kind of work which we have been doing. But naturally, as a teacher, I always feel that it is not enough. So we should expand our activities, and where I think it is the responsibility and it is the privilege of all of us. So thank you very much.
Thank you, Palan sir, for your motivating words and for your guidance. Yes, we will definitely put efforts to, shoulder our responsibilities in this role. Thank you so much. I have the pleasure of inviting our respected Vice President, sir, Dr. Rakesh Jain, sir, to address the gathering. So kindly share your valuable thoughts with us.
Thank you, Nivedita ji. Respected Palan sir, all senior members, Sundarama sir, Dr. Mirchandani, Dr. Prasanta sir, Dr. Amita Puri, and all other guests, friends. So it always gives me pleasure to be present in a program on hypnotherapy. In fact, for a long time when I began my career in hypnotherapy, I was missing the links, and there were very few practitioners known to us during 80s when I took the interest in hypnotherapy. It was in 2009 when an international conference was organized in JNU. So I came to know about the senior professionals working relentlessly in the field of hypnotherapy. And when I looked into the profile of Professor Palan sir, for a long time back, he did his specialization in hypnotherapy, and he has been instrumental in mobilizing all the programs we are seeing today in Vadodara, MS University and Charuset. So it successfully initiated the programs, first offline program and then contact learning program. Initially, I had an idea that contact learning program may be difficult for a subject like hypnotherapy, but when I interact with the students, I visit there for delivering lectures, and I find the students from all fields of medicine, psychology, and healthcare profession. And about 500, it's a good number, sizable number, that 500 qualified hypnotherapists have been produced in the country. And this number will keep on increasing every year. The idea of Academy of Hypnosis, I like to share that how this idea emerged, initiated. So during COVID, post-COVID time, there was a national conference of Indian Association of Clinical Psychologists organized by FMC Pune. And a special symposium was organized for hypnotherapy. Dr. Palan sir, myself, and Professor Kaptan Singh Sengar, we three chaired the session. And afterward, Palan sir expressed his desire that why let us have one conference on hypnotherapy. Then we started working on the idea of hosting a conference. And then during the process, we felt that without a formal body of hypnosis, it will be difficult to organize a conference. So the idea of Academy of Hypnosis was launched and successfully registered. And in June 22, we started functioning. And within this short span of time, we have organized international conferences on hypnotherapy, workshops, monthly clinical meets, newsletter, regular meetings of the body of Academy of Hypnosis. So all are working in an organized manner and to make the progress happen. And I think that with these efforts, still we are in the foundation stage, we are laying the foundation, sir. And this will grow in a big tree in due course. There is only one wish, major wish left, that why don't we have an international conference of hypnosis in association with international associations in the country. So maybe sometime we can work for that also. It will be a great achievement, and a dream of Palan sir will be fulfilled if we could host that. And I'm happy that the community of qualified hypnotherapists is building up. And in this country, we don't have any formal regulation for hypnotherapy course. The course is run by Rehabilitation Council of India, do essentially incorporate, when we complete our MPhil in clinical psychology or PsyD in clinical psychology, hypnotherapy is supposed to be an integral part of those training programs, and also in medical disciplines is integrated. But as an independent science, there was a circular long back from ministry that it is to be practiced by qualified professionals. And this qualified professional, I consider the formally trained professionals who acquire their diploma from these courses. These are the qualified professionals, and the manpower which is coming up, the trained manpower of hypnotherapy, I think in due time, in the course of time, this will come up in a big way, and it will be, there will be more research programs. I supervised at least 2 to 3 PhD thesis on hypnosis, and I still encourage the students to work on it. So we have to work both for application and research in the field of hypnosis. I think the students and the next generation will take more interest in this form of hypnotherapy. So with this, I remain, and I wish that this our vision, the vision of Lancer and our collective vision will get manifested in a big way. Thank you, sir.
Thank you, Dr. Rakesh Jain, sir. Thank you for your inspiring words. Thank you so much, sir. Yes, Palan, sir.
One moment, Nivedita.
Yes, sir.
I'm sorry, Amita ji, I didn't see you. I welcome Dr. Amita Puri for this occasion. You're most welcome, madam, and your contribution will be there in our symposium also, panel discussion. You are welcome.
Thank you, sir. Thank you.
Welcome, Dr. Amita Puri, ma'am. Ma'am is having more than 20 years of experience in the field, and it's a pleasure to have you, ma'am, here on this event. Thank you so much. And now we come to one of the most anticipated session of today's program, that is panel discussion. Panel discussion: hypnosis, past, present, and future. This discussion will be moderated by our moderator, respected Prasanta sir. Sir, I request you to take over. Thank you.
Good morning, everyone. Hello, am I audible? Yeah. It's a joyful moment for all of us to have our anniversary observation. It got delayed due to sudden demise of our beloved Dr. Bhaskar Vyas sir 2 weeks back. So we had to reschedule the program. And we also expected the couple of guests, Dr. Tushar from Varanasi BHU and Dr. Urminanda Vishwas from Delhi University, who accepted to be part of it. But due to some change in the schedule, they have actually gone for an international conference on psychology outside India. So today we'll be focusing on a discussion where the scholars of hypnosis here in India, some from psychiatry background, some from physiology, medical science background, some from psychology background, some from clinical psychology background. So we'll try to provide a basic understanding on hypnosis from past, present, and future perspective. So here we are having 4 panelists. We are having Dr. Bhupendra Palan, who is the president of our Academy of Hypnosis, and he is behind our inspiration to form this Academy of Hypnosis. And to introduce him from very personal perspective, when I was doing my undergraduation study from Maharaja Sahajirao University of Baroda, my thought behind coming to psychology is hypnosis. And because of hypnosis, I came to psychology. That was the first thing. And that is the honest response. And that's why I went to Baroda. Because many people ask why from Kolkata I had to shift to Baroda. It was because I had some understanding that some work on hypnosis is going on. And somehow I got to know about that some training would be provided by Dr. B.M. Palan at a yoga center there in Baroda, and it was organized by the Mark Counseling Center of MSU Baroda. And I had the privilege to join a monthly course there, and that was really an eye-opening experience, because before that, though I said that I actually came to know about hypnosis before then I learned about psychology. But once I started getting some scope to learn about hypnosis, the kind of ideas that I had uh, that started changing. And it's a privilege to moderate this particular session where my mentor, my advisor, and my model, uh, who is going to be the part of this panel discussion. And I'm sure he is going to give us a good amalgamation of the philosophical aspect, the neuroscientific, neurophysiological aspect, and the psychological aspect. Because I see him more as a psychologist now than a medical professional, the way Sir has changed his paradigm. And we are also having another, my beloved person. I want to touch him a lot emotionally, but he is very resistive about it. He is very defensive about, no, no, Prasanto, do not approach much. Uh, so, uh, so it is Rakesh Jain, sir, who is the professor and head of the Department of Psychology at Gurukul Kangri University. And uh, and probably this JNU conference only I first time came to know about Rakesh Jain sir in 2011, though we are passed out from the same institute, that is Central Institute of Psychiatry. He had been my super senior, and later on somehow we started getting connected. Lots of intellectual discussion happened, and sir once wrote a book on power of hypnosis, and sir invited me to write a brief chapter on Indian knowledge system and hypnosis uh, on that. And then when I read his book on, initially the discussion was not about hypnosis, but it was about the Rorschach projective test. Uh, we were working on it. And then when sir wrote a book on past life regression therapy, uh, I might have my personal reservation related to the term, but this particular book, it's a must-read book to understand the human psychology, the way human perceive, the way human experiences happen. It's a must-read book. It's a very like it's story kind of book. Even when you're traveling in train, you can read that particular book. Such so much of experiential. So we are fortunate that Rakesh Jain sir, one of the very perfectionist clinical psychologist, is going to be with us. And we are also having Madam Amita Puri. Um, this is the first time probably I'm meeting her, and whatever I could gather, Madam, please correct me if I'm wrong. Madam has is contributing to the field of clinical psychology. Uh, she had done her PhD from Chandigarh. Is it right, Madam? Yes. She
Yes.
had been associated with IIT Delhi also, and now she is having her own organization where she is the founder director, and she has been contributed immensely how to survive a narcissistic uh, injury, and she has written a number of books on uh, those. And she had training in clinical hypnosis from USA, and she has been contributing for last 30 years in the profession. Uh, so it would be pleasure to learn about this particular concept uh, uh, from a different paradigm. And also we are having the one of the most senior, very respected, reputed psychiatrist, Dr. Dayal Mirchandani. Sir, when I came to know about Sir through Bhaskar West Sir only, he was working as a private practitioner in Mumbai. And now Sir has shifted to the Pune. And probably he's among the few psychiatrists who has the learned about hypnosis at very deep level. It is not only the blind learning of hypnosis, everyday learning on it through various journal, various resources, and trying to contribute to the others. And he was among the few psychiatrists in India who has emphasized the role of the psychological aspect of the mind in the psychopathology. So it is always pleasure to learn from sir. With this, we are having other dignitaries also, other professionals also. Maybe at the end part of the panel, if some of you would like to contribute something, we'll be happy to hear from you. So if you look at this particular theme, that where we are going to talk about hypnosis, past, present, and future, it has traveled a fascinating journey. If you look at the ancient knowledge system, this Samohana Vidya, Yoga Nidra. So from temple sleep and mesmerism to the modern neuroscience, evidence-based psychotherapy, and emerging applications in medicines as well as mental health. And not only that, even in sports and other domain also, now hypnosis is well oriented, though people might not be taking the name of hypnosis everywhere. Yet it remains one of the most misunderstood areas in the field of psychology today. So let us explore not only where hypnosis came from, but where it is heading to. As Sir Palan said that like his dream is to popularize the subject in a way so that young generation can take up more projects. As Rakesh Jain said that there had been already 3 PhD work under him. 1 PhD work has just started under me also on cognitive hypnotherapy. So there are more research-oriented scopes are there. So I'll begin with Rakesh Jain, sir. Yes, sir. If you had to identify one historical event that changed hypnosis from mysticism to science, what would be and why?
That is about the past of hypnosis.
Yes, sir.
How it turned up into a scientific domain.
Yes.
So I think I should give credit to Abbe Faria, the person from Indian origin. He had a very good scientific understanding of hypnosis. In fact, many contemporary professionals of that time didn't know that how hypnosis worked, and that in fact strengthened the position of hypnosis from psychological point of view. He had a very good idea that suggestions influence the mind, and through suggestions we can achieve trance state. And during trance state, we can comfortably interact with the person. So Abbe Faria was Portuguese. He born and brought up in India, and then went to France, and then interacted with Pussiger and all other persons of that time, and he successfully promulgated the idea. And I think that we can comfortably consider as a benchmark that how hypnosis should be viewed more scientifically. Though Anton Mesmer's work was there, but Anton Mesmer's work had a that nomenclature of animal magnetism, which was unexplainable. So I think Abbe Faria, for me, he is the inspiration behind that.
Thank you, sir. I would also like you to emphasis, how do you consider the Braid and Sarko also as part of this journey?
Braid and Sarko.
Also Freud and Freud also.
Yes, they came later. Braid, Sarko had a physiological notion of hypnosis, and that the idea of suggestibility was not in his functioning, as I understand. And Braid, of course, turned up that hypnosis, that hypnotism. He had a different term for that. And again, he had a physiological explanation, both Braid and Jean-Martin Charcot. So they were approaching the task from a different perspective. So Rabbi Faria had a very good idea, which in fact we are practicing today, that is hypnosis suggestions. We are using primarily suggestions both for preparation of the person, induction, deepener, treatment, termination, post-hypnotic suggestions, that we are capitalizing mostly on suggestions. So that's why I'm more oriented to him, that the suggestion is the key behind mind. So what was the other?
Thank you, sir. I can remember that Rakesh Jain has, in number of occasions, number of interactions, a number of academic lectures, he has mentioned that hypnosis to be considered as father of psychotherapy.
Exactly.
And
Regarding Sigmund Freud, also you had a question from me. Sigmund Freud, of course, he interacted with Jean-Martin Charcot, Joseph Breuer. He worked on hypnosis, but he has his own idea. He has a different conceptualization. He approached the subconscious mind from a different perspective. So he favored his own techniques of psychoanalysis, particularly Fury association and his conceptualization of theory of mind and personality. So he, instead of contributing majorly to the work to the concept of hypnosis, he worked mostly on psychoanalysis. And somewhere I read, because he practiced free association psychoanalysis, it delayed the progress of hypnotherapy, scientific hypnotherapy somehow. Thank you.
okay, so I'll go to Dayal sir, and as Rakesh Jain sir was telling, so Freud eventually moved away from hypnosis. Was that a setback, or did it indirectly help psychotherapy evolve, or delayed the process of psychotherapy?
I think Freud criticized hypnosis, possibly because he was not a very good hypnotherapist, or some people believe because he wanted to, he was self-centered and wanted to create his own form of therapy. So, and psychoanalysis originally comes out of about 13 patients. So it's not a very large, the major cases who he treated. So Kluft and others have written papers on this. So I really don't know if he, but he did make the unconscious very popular. So, and hypnotherapists along the side, but the Freudians tried to block any other forms of, like Milton Erickson, they filed complaints against him in the American Medical Association, American Psychological Association, because he was both a psychologist and a psychiatrist. So I don't know about that, but that's how history works.
Thank you, sir. Dr. Puri, would you like to reflect on this, that this Freud's separation from hypnosis?
Yes, Freud, his works are very important, and of course, I mean, especially his work on psychoanalysis, which started with, basically, he started with the hypnosis, but probably that was taking a long time, and they were more focused on short-term goals, short-term gains during therapies, and that is how the shift happened. And but Mesmer, Charcot, Freud's, everyone have their own contributions towards how we consider hypnosis today. And in my practice, even in hospital OPD, and like Dr. Rakesh Jain has been doing a lot on past life regression, and he wrote a book also on that. So, of course, we are taking our roots from these great people who did some important work that time, and now it has fully blown into various components and various compositions, various dimensions. And PLR, I can say for sure, because that is something I do in my OPD most of the time. Sitting also. I mean, letargic karna is one thing which I'm doing in my practice, but in hospital OPD only. And there are various cases almost every single day that yes, past life regression, because many things, many issues which people are facing, the medical issues, the physical issues, and emotional grief or stress or depression or whatever they're going through, which is making the like you're trembling, you're not able to focus, and everything is fine, but whenever you have to sign, do the signature in somewhere, so your hand starts trembling. So all of those components, kahin na kahin, it has features some deep rooted issues, and when we do that, and we achieve great results. And for that, the founding fathers, all of these, they are very important, and we always remember their work and their philosophies, because that is they reaped this, they sowed the seeds, and we are reaping the fruits, and in future also great many things are going to happen for sure, with the right guidance of great Indian thinkers we have here, Dr. Palan and Dr. Bhaskar Vyas, again a great person, intellectual in this area, and Dr. Dayal Mirchandani's work, Dr. Rakesh Jain, is just absolutely awesome.
Thank you, madam. So I'll come to Palan, sir. Like throughout the history, hypnosis has been surrounded by lots of myths and stage performances. Why has scientific hypnosis struggled to overcome these misconceptions?
Yeah, I think scientific hypnosis had to struggle mostly because of over-claiming, over-enthusiastic proponents rather than opponents. Actually, in India, I feel many lay people pictured cured by hypnosis, that kind of thing. And that harmed the scientific progress of the science. That is one thing. Another thing, I feel from the very beginning, there is a taboo, this magic type of taboo. So it's used for fun and entertainment on the stage. That has also harmed the scientific progress of the science. This is what are my thoughts.
Yeah, yeah. The strength of mind and the wonder full aspect of the mind or the human perception, those are being like used as a fun making game. So that might be one of the issues also. And there are other people, many of the faith healers also, or many of the like unscientific practitioners also, they probably knew this aspect of the mind and they misutilized it for their personal gain. Uh, and there might be power hierarchy, the gender hierarchy, those issues also probably were quite prominent in every culture. So that might have contributed. What Dayal sir, you what would be your perspective on
My
this? Yeah.
perspective is same Mesmer. He was getting
Hmm.
good results, but it caused a lot of problems for two reasons. One was the economic, capitalistic kind of. The other doctors were losing patients, and the second was that he claimed it is because of animal magnetism. So his, I think there was some American, I've forgotten his name, who was also a part of the commission they organized to check. So they were not able to verify that there was any kind of magnetic field that was causing this. He had magnetized rods in his mesmeric tubs. So one was, the science was not advanced, and number two was that they were economic. And the same thing has happened with, because hypnotherapy is much faster than many of the traditional, the other forms of therapy. So there's a lot of turf wars. So each one claiming mine is better than yours, but not saying that many of them have come from hypnosis.
Thank you, sir. So how do you define hypnosis today, if you have to define?
In that, for me, it's an altered state of consciousness in which the mind is open to suggestibility, and also you can create or suggest physiological changes in the body.
Jain, sir, the socio-cognitive school, they challenge the basic construct of hypnosis as a state, a trance kind of state.
Yes.
And they said there might be the role playing on behalf of the person. And there are cognitive aspects as well as the social expectations that might have created. So that might challenge the overall understanding of hypnosis and the traditional understanding of hypnosis. What is your take on this?
I read it thoroughly. There's a book, Scientific Hypnosis, and it presents very good experiments which refute the idea of trance as a state. That you give suggestion, a specialized awareness state is created, and then therapeutic work is done. The intermediate state is being disputed. We call state versus non-state controversy. But personally, when I analyze the working of mind, so I think what the idea of the non-state theorist has to understand is that a switch from waking awareness to altered awareness takes a moment. It can be a fraction of a second. So once you give a suggestion, which creates an imagery in the mind, which evokes the emotions, when you engage in evocative communication, that state automatically built in. Unless that state is built in, the further work in hypnosis is unlikely. So my understanding, by analyzing all non-state theories and understanding of hypnosis, my own view on what hypnosis is, I consider that state is an inherent part of hypnosis. And I prefer the conceptualization in terms of classical conditioning, that there is a conditioned stimulus which elicits a conditioned response. So I take all suggestions, all evocative communication as conditioned stimulus which elicits a conditioned response which reflects in the brain as well as in psychophysiological state of the mind. So I go by state theories instead of non-state theories.
Thank you, sir, for your...
I would like to add one more thing, that in my experience, in due course of my learning of hypnosis, initially I started with Wahlberg's arm levitation method, which was taking a longer time, even 20-25 minutes to induce the state. And at the end, as on date, I say it is only 4 phrases. You speak 4 sentences to a person and the awareness is altered. Very simple. Sit comfortably, close your eyes, visualize any place. It can be an religious place, a spiritual place, or a simple park, and tell me what you are seeing. Once the person reports that says it is a park, there is a greenery, there are flowers, that means the person has already moved into that suggestibility state. Only 4 terms. And with these 4 terms, I'm taking persons into deepest level of trance, working on even regressions, all kind of regressions, all kind of post-hypnotic suggestions. I do demonstrate, I am working, practicing. So with this, I came to understand that it takes few moments for alteration in awareness to take place. Thank you.
Okay. As Sarah has already started about the induction process, I'll come to Dr. Puri. Uh, like if the whoever the newcomers in the field of hypnosis, they are having an expectation that and the probably instant hypnosis is going to do work, and how quickly one can induce the hypnotic state of an individual. So what is your experience on this? Like what mode of induction in clinical practice is actually to be worked upon, and what can do a better outcome?
Yes, so I agree with Dr. Jain that yes, it takes 4 sentences or simple ways in which we can transition, we can help the individual transition from his normal state to the trance state, and that really works beautifully, as simply as it can be done. So when we are made the repo, develop the repo, and the person is comfortable, so it's very important the person should feel comfortable. That is the initial state. Then only is going to listen to you for those things to the trance state to happen. And then yes, it takes little seconds, some few seconds, some take longer. Some people, as all of us have experienced, some people say that they have never been hypnotized, they can never get hypnotized. ऐसे हो ही नहीं सकता. They have been to various people, but it all depends upon one, the expertise, and that is what AoH stands for: the expertise, competency, mastery, specialization of the individual who is doing it, and the kind of repo. I mean, you may be having all those degrees or experience, but the repo establishment in the beginning, where the person feels very very comfortable that here it's a safe place for him, and then yes, these kind of things happen, and the way we touch the individual. Sometimes that TFH, touch for health concept, can also it works beautifully when you're just touching the individual, his or her hands. Again, depending upon gender, we see how this can happen, or through eye to eye contact we are doing that. That is also kind of touch for health, the ETC which is happening. And then once the person emotionally, he has got suggestible that yes, this is a place, his safe place, his safe zone. And then our tonality, our voice, our demeanor, the place around, that also helps in creating that ambience of that fast transitioning to happen. Yes, instant hypnosis, many books have also come up, and people also want, आजकल सब shortcut, Gen Zs, especially Gen Zs, Gen Alpha, Gen Beta is also now come up. So they want faster things to happen, jaldi jaldi aa jaye. And 1 day 2 day courses करके they think कि वो आ गया. So of course it requires a lot of experience and lot of rigor in the process, one, but you have to do that emotional suggestibility, then the physical thing is also bound to happen, and then slowly we are taking him to the another side, which is very very important. There are various ways in which we can do, like handshake interruption induction, eye fixation, or arm drop, hand drop induction. So inductions quick hote hain, but only thing is it requires a lot of expertise, and this is a message which needs to go to the Gen Zs and Gens Alpha. Okay, it's not going to rapid progressive relaxation, shock or pattern interrupt induction. Various kinds of induction techniques are there. They need to learn it, they need to to experience that, and they need to develop the expertise. It's not abracadabra, but it is science. And मनोविज्ञान साथ में वैदिक विज्ञान, so ये हमारी वैदिक विज्ञान पद्धति है, जो which we need to imbibe. and so many things happen. Even हमारे सुंदरकांड में आता है, हनुमान चालीसा में बहुत चीजें हैं. So वो जो words हैं कुछ, वो दे रियली मैटर अ लॉट. और वो भी कई चीजें, अगर इतना ही बोल दिया ना से रोग हरे सो पीरा, यही आप रिपीट सजेस्ट कर दिए ना आपने, ना से रोग हरे सब पीरा, ये इतनी सी बात भी उसके दिमाग में डाल दी कि एक बार आपने नाम लिया और वो चला गया. सो पीपल हैव एक्सपीरियंस कि यस इट हैपेंस. Even today only, there was this 68-year-old person, and he's having trouble with his eyes. Old age ke saath ye sab cheeze, they are part of it, many things. But every time he comes for that, he calls it, and we call it, energy healing session, and it's working beautifully because mentally, emotionally, he feels connected, and within 5 minutes, for another hour, he goes off to sleep. And whereas his family is saying that he has difficulty, and he himself also acknowledges he has difficulty sleeping. But here, whenever he comes to our center, within 5 minutes, he's snoring away to glory for another half an hour to 40 minutes. But the sound healing, or the hypnosis techniques, it is happening. It matters. It works beautifully. But we need to develop the expertise, and expertise which comes with experience over the years. And that is what AoH stands for, the scientific explanation of everything, and going it in a very scientific manner. This is very important, and that's the message to budding mental health professionals here.
Yeah. So not to try for number of techniques, rather be master for one or two techniques, adhere to that, and that will make you master that you want to convey, madam. Thank you. One of the, like, when you look at the controversy, one of the evidences behind the utility of hypnosis, we try to study the neuroscientific basis, neurophysiological basis of hypnosis. And here, Dr. Palan sir, if you can highlight on what modern neuroscience has taught us about hypnosis that was unknown even 20 years or 30 years ago. Shall I repeat, sir? Palan sir?
Is it, yeah, my internet is very weak. It is not stable, very unstable.
Yeah.
So in between it gets low. So I couldn't hear.
What has modern
that
neuroscience
you-
taught us about hypnosis?
Yeah, that is something very interesting. The nowadays, like especially after in this century to after 2000, there is really flooding of studies of hypnosis by neuroscientists. So there are gradually physiological theories developing in hypnosis. So basically, it is the procedure which we conduct that leads to decreased stem reticular formation. The generalized excitation of the entire cortex is reduced. The entire cortex is relaxing. And in that state, when a voice being at a particular spot, sometimes in induction process, we do that. So these monotonous signals, the voice, the visual monotonous signals, so this will excite some particular centers in the thalamus, thalamic reticular formation. And they are projected to some part of the cortex. Thalamic reticular formation is more specific. It activates specific parts of the cortex, while brainstem reticular formation is generalized. It activates the entire cortex. So entire cortex activity is reduced, and there is a focal activation in some part of the cortex. So that is how the focal awareness is enhanced and the global awareness is reduced. That is what we say in psychology. That happens actually neurologically. So there is a active spot that they call watch spot that develops. So that is a theory which was built before 2000, but after 2000 there are a lot of other things, but it is so technical I won't be able to explain it like this without the slide. But the prefrontal cortex, especially the dorsolateral prefrontal cortex, and the activity in the cingulate cortex, this coordination happens. There are certain steps in induction which will create that. So that's how it is created. So I think the state of hypnosis can be explained very well nowadays with neuroscience. Maybe Avnish also wanted to say something in that regard, perhaps, I don't know. But yeah, physiologists are very much interested in studying neurophysiology of hypnosis. So these are some of my thoughts.
Dayal sir,
Thank
would
you.
you like to add anything?
Yeah, I think, see, there are two things that have come up. One is the PET scan. This is a positron emission scan. So you can give certain, what do you call it, radioactive isotopes, and it shows you which areas of the brain are active. So you can see in real time that, and then patients are given suggestions through headphones in that scanner, and they've been able to show that the same kind of changes happen under hypnosis which happen in real life. So if you're seeing an image in real life or touching something, under hypnosis you can create that. So that's one kind of evidence. And the other evidence is, which works for psychotherapy also, that as you do hypnosis, there are physical changes that remain in the brain, certain activation areas and all. So they are between there's EEG, these are electrical stimuli which are measured. Now we have AI also measuring it, and you're able to detect changes in the, earlier we couldn't detect those. But now, because of newer technology, we can see that it does lead to positive changes in the brain when suggested. And can also lead to the opposite, the nocebo effect, or you can have, so there's a lot of scientific research still going on. And we have new tools for that.
Yes. Thank you, sir. Thank you. Professor Jain,
Yes.
as we are all aware that India has a rich tradition of meditation, yoga, dharana, mantra, visualization, and contemplative practices. So, can this be meaningfully integrated with a modern clinical hypnosis without compromising the scientific standards?
I thought over this hypnosis versus our meditative state in detail. So I formulated that at a stool level, at a physical level, we are operating in the domain of hypnosis. But as we progress in our meditative state towards advancement in consciousness, then we are moving towards goals of meditation. I think both are not opposite, both are the same thing, complementary at physical level. So whenever you sit in a meditative state, that means the hypnotic trance state is automatically building up. And the concentration part is also there in meditation. And that concentration part is just to consolidate and enhance the trance phenomena. And after that, whatever we do in meditation, whether it is focus type or passive type, that is the aim of that is advancement in advancing the consciousness level. So for hypnotherapy has a different purpose of, it is a therapy. Hypnosis is used primarily for hypnotherapy by clinicians, by us. So we have an agenda of changing the psychological disorder state as well as promoting well-being up to that level only. The thought level, feeling level, physiological level, action level. But meditation has a different goal of achieving something higher at consciousness level. But they are not, certainly they are not contradictory. They are the same thing to a certain extent in the scale. Can I raise one question in continuation? I was raising hand.
Yes.
Yes. So Palan sir and Mirchandani sir pointed out the existence of authentic, objective, physiological basis of hypnosis. That there are certain changes at focal level which are irradiated at a cortical level, generalized manner, which is a indication, objective indication at physiological level of trance state. So these evidence, do they point out to the state theories or support the state theories or non-state theories? That is the specific point I want to know. Sir.
Can you please repeat? Can you please repeat your question, sir?
Yes, my question is that the modern neurological findings do indicate changes in the brain, physiological level. There are certain changes in the brain under trance state. Okay, that is established. Then at the other point is that we have two theories, state theories versus non-state theories. The existence of changes at brain level support the state theories or non-state theories, or both?
I think it comes under state theory.
That is also
a peculiar neuropsychological state. It is psychophysiological state.
Yes, sir.
Created.
I prefer the term psychophysiological
state. It comes under state.
Yes, sir.
It's a psychophysiological state or psychoneurological, physiological through neurological autonomic, it affects the entire body. So I also believe that it is state.
Yes,
peculiar state.
I also
and one more point.
Yes, it also considered the continuum state. Yes, Dayal sir also wants to
one like roughly, not very scientifically, but roughly I tell people, because people know meditation as a word, they know it. In detail, they don't know actually experientially, but meditation is a more popular word and more acceptable word. So I say that hypnosis is a structured, guided, and goal-oriented meditation. This meditation, but little more structured and a little more guidance is given to you. And you have a particular goal, what Dr. Jain told, some agenda is there. While spiritually, meditation, when you do it for your spiritual growth. And you are not very clear what do I mean by spiritual growth. While here there is a clear-cut goal. So that is how I explain structured, guided, and goal-oriented meditation. Not very scientifically.
Sir, the next question would be on this. And next question would be on this.
Right.
We'll also like to learn more in an elaborate way on this. But Dr. Dayal wanted to say something.
Yeah, I just want to say, see, the state theory came from using hypnotic tests. And these are all direct suggestion tests. So only patients who respond to direct suggestion are supposed to be hypnotizable, and that's why they came up with the state theory. But later, Dr. Fricton, who was a dentist, and Joseph Barber, he was one of the student of Joseph Barber, they used another method, which is indirect suggestion, more Ericksonian. And they found the result, if the results in terms of pain control were equal in both groups. So you kind of assess the patient if he is susceptible to direct suggestions or indirect suggestions, and then you use that kind of methodology. So, and you evoke the state through using different types of word in the indirect suggestions, so that most people are able to benefit from hypnosis if you have that flexibility or training. So the whole question of state, non-state is based on a measurement instrument.
Thank you, sir, for clarifying on this. So, as I was telling Dr. Palan, sir, like if you can elaborate this, how the concept of Sankalpa, Yog Nidra, Pratyahara, Dharna compares psychologically with the hypnotic phenomena. If you can elaborate on this.
I may not be very clearly explaining it, but yes, Sankalpa or Dharana, or the way in which
And Sanskara also.
Yoga Nidra, Yoga Nidra is being practiced nowadays. So there is an element of suggestions. And Sanskara is a very different thing. Sanskara are the what we know as schema, psychological schema or psychobiological schema in the psyche, or what we can call frames of references. So, of course, sanskara, they say, are of three types. Sanskara from the past life, sanskara gained by genetic transmission, genetically transmitted sanskara, and the sanskara which are created in the individual by experiences, information, and that. What we are working with is sanskara, not the genetically transmitted sanskara or past life. Of course, past life regression therapy works with those past life sanskara also. So sanskara is a different thing, and this dharana or
Pratyahara.
yeah. So all these are kind of suggestions. They're taking the form of suggestions nowadays. Originally in yoga, the pratyahara, dharana, and dhyana, that was the process described. Pratyahara is inward movement of the sense organ. From outside, your sense organs are moving inside. Pratyahara. So they say the seen outside is ahar for your chakshunendriya. So your eyes are closed, so it is not taking that, but from within the visual scene which are seen earlier, you remember them. So that is pratyahara of your vision, that chakshunendriya. Similarly, outside sound ki bajay your the shravanendriya is focusing inside. That is pratyahara. It then is utilized for dharana. This is internal focusing is focused somewhere in some cognitive or affective process. And then when you do it effortfully, it is dharana. But when effortlessly continuous mind is engaged, when it becomes automatic flow, that is known as dhyana, meditation. So pratyahara is the beginning, then dharana and dhyana. So that's how they describe the whole process of meditation. And I think in induction of hypnosis also something like this happens gradually.
Thank you, sir. The next question is open to any four of the panelists. Can India's traditional contemplative knowledge contribute something genuinely new to the
I
global
understand
understanding of
that.
hypnosis? Can India's traditional contemplative knowledge contribute something genuinely new to the global understanding of hypnosis rather than
May
adopting the Western models? Yes, sir.
I speak? See, if you are talking about hypnosis, maybe yes, a little bit. But if you are talking about therapy through hypnosis, it can add into the therapy a lot. Our traditional philosophical or spiritual understanding, the depth which it has, I think it can contribute a lot to modern psychology in therapy, not in developing the hypnotic state. Developing hypnotic state, I relate it. It is better explained and better experimented in the Western world by the scientific tools. That is what I wanted to say. Thank you.
Okay. Dayal sir, many
Yeah,
clinicians are, yes, many
I just want to
clinicians
add
are,
that there are
yes,
methods
yes, yes,
that
yes.
have been developed drawing on our Buddhist and Hindu philosophy. But one example is what Dr. Daniel Brown did, which is he has developed a method of treating attachment disorder. These are people with severe, borderline, those kind of severe issues, and they use a Buddhist kind of loving kindness meditation where you're teaching. But in this, they teach people to go into a trance and then imagine that their parents they have spiritual godparents or their own parents are behaving differently than they really behave, in a more loving, more available, more present manner. And that has improved or even cured some people with these disorders. And they've done some research on it, and it's fairly well spreading. So, like that, there are a number of techniques that have been modified, like even yoga nidra and all have been modified for use with hypnosis. So,
Yes, to continue the conversation. So, in typical Indian traditional concepts and their knowledge from the epics and Vedas, so in various ways, they can also form, they can help in, especially when we are using therapy in hypnosis, hypnotherapy as such, which Dr. Palan also mentioned. So, using Vedic Vigyan and Manovigyan, the clinical psychology and evidence-based from neurosciences and Vedic Vigyan ko mila ke. So that kind of concepts, So there's a book also we have written that is on the PAT, psychoastrotherapy. So if you Google the name psychoastrotherapy, the book will come up. So that is PAT. PAT is Sehlana. So many times when we are doing psychotherapy and hypnotherapy for various issues in the individual, so we are using astroanalysis as part of what Vedas, our own Vedas have given, and from a very scientific perspective, we are doing it even in the hospital OPD. So we have someone who has knowledge of this. I also am interested. I have been interested. I grew up in that kind of atmosphere. So using that as a Vedic Vigyan and various aspects of those Vedic Vigyan, that is a tradition and yoga, yogic kriyas, so all of those things together, when you're using the Vedic Vigyan given to us by, our people 5,000 years ago, and the Gyan which is given, and there's lots and lots is ocean like that. So when we try to connect the dots there, some with our little buddhi, the Vedic Vigyan and Manovigyan and evidence-based medical physiological aspects of those, it really works beautifully, because when we are using astro analysis also, that okay, this time is, whatever from planetary positions, why don't you lie low, and you can start doing something in this month, and whatever the issue of the individual is facing in their personal life for which they have come. So we're using that very, very thoroughly, comprehensively, effectively in the OPD itself, and in the hospital OPD itself, and in my own practice. And our team of psychologists, they also are involved, and a lot of things are going on, and lot of work needs to be done in this area. Some research work also has been done in this area. Some papers also have been published. This another book, PAT 2.0, is also in the process, because ocean of knowledge is there in terms of Vedic Vigyan, and joining the dots with especially the hypnotherapeutic the areas, dimensions and psychotherapy together, along with medical evidences and medical work together, because when, in many cases, medicine along with therapy works beautifully. So both the things have to work together. And a holistic healing, we are talking about the holistic aspects of a person's healing. So when together all the sciences, all the specialists, they work for the holistic healing of the individual grows, the family members, family therapy also become part of that. The family grows, and the growth becomes exponential, and that is what we have been trying that in our practice. And that is what I have to say in this. And especially Ramayan mein jaise we use so many of things like past life regression or whatever. So past life, हनुमान जी को जामवन ने याद दिलाया जब वो संजीवनी बूटी लेके आनी थी कि तुम तो पवन पुत्र हो. So जामवन के वचन सुहाए, सुनी हनुमंत हर्षि हबाए. So reminder of our power to empower us in the present. So when we go into regression therapy or FLP, future life progression, what is happening is we are getting, and with the power of suggestion, we are getting empowered in our current life to be able to live the present life more beautifully. And the holistic beauty of the individual, the holistic personality of the individual works beautifully. So that is how we are using the Vedic Vigyan and the hypnotherapeutic aspects, and along with our medical doctors as a team, we are there. We have a MD medicine person, we have a psychiatrist in the hospital, we have clinical psychologists, we have group of other counseling psychologists, yoga therapists, and physiotherapists. So together we are trying to achieve many things together as a harmony. So Vedic Vigyan is an ocean, and we need to just एक एक बूंद भी लेके आते, इतना beautifully चीजें बन के आती है. And this area, this space has lots to offer. Thank you.
And Dayal sir, now
I would like to just say a little that we have so many stories, whether it's the Mahabharata, whether it's there are so many stories which we can utilize, and they make more sense to our patients because they've heard them before. But many times they don't make an impact. When you do it under hypnosis, it has an impact and changes the patient's beliefs and values and ideologies and all those kind of things in a way that they can utilize it in their life and work, change their beliefs. Or so I would, if someone had the time and the thing, they could even write a book of metaphors based on Indian psychology, Indian mythology and stories and all that kind of.
Then in continuation this, what condition have the strongest evidence for clinical hypnosis today?
You're asking me, so I'll tell you. The one that has the strongest hypnosis thing is for irritable bowel syndrome. Palan and Morwell, these are the people who've done a lot of research. 80% of patients get better with a large number of cures. And diet, nothing compares to what the results they are achieving through hypnosis. And a lot of it is, the first part of it is just 1 or 2 sessions of hypnosis followed by audio tapes or MP3s of suggestions regularly over a period of 9, 12 weeks, 14 weeks, and they're getting good results. And then the patients who are left over, who don't respond, individualized hypnotherapy works there. So you can increase the success rates even higher. So
What are the other conditions you would suggest hypnosis as a like choice of treatment?
I'm talking about the medical thing. Then there's a huge number of patients with anxiety related to injections, to MRIs, to so there's I've forgotten her first name, Langs. She has written a comfort talk. She teaches doctors and other people how to with script-based hypnosis help people get over that so that they can have their injections or do their dental work, dental phobias, all those kinds of things. And she's published a number of papers on the success rates. So I'd say that's another example of scientifically
And
validate in the
cancer
medical
care
field.
and pain.
David Spiegelwerke, in fact, did group hypnosis with breast cancer survivors. He got they live twice as long as an what do you call it, control group in his group, but no one else was able to replicate it, because I think belief is important in this. So if you're trying to disprove it, that kind of thing comes out in your results. If you're trying to prove it, that also comes out. We know influence, we know that belief of the therapist in their method is important. So, but he had done work on that, and if apart from anything else, it works to help cancer patients tolerate their. I've used it with a number of patients to tolerate chemotherapy, not get so nauseous, reduce pain, whole lot of things that it has many uses to deal with the fears of dying.
Palan sir?
Yeah, in my experience, psychosomatic issues like asthma, my own case, and then many patients of asthma are helped. Migraine also, it works well in many cases. Acid peptic disorders, that comes third. And of course, IBS, as Dr. Dayal told. So these are the conditions. And pain, issues of pain also, it has helped to some people very well. So these are the physical things. And in psychological cases, anxiety, phobia, these are the cases where it definitely works very well. In my experience, these are the common conditions. Even, habit disorders, stammering, and this in young children, that nocturnal enuresis, aneuretic problem, bedwetting type of problem. So, or thumb sucking, nail biting, these kind of issues in younger children. So there I have used it quite successfully. I am not aware of the literature. I won't be able to give references like Dr. Dayal, but there is my experience. Dr. Dayal, I really appreciate your all sharing of references. It's a really wonderful job which you are doing. I'm so very happy. Whenever I get, I immediately save it. I don't know when I will read those things, but I have saved a lot of those references. Thank you.
Professor Chen, what about the psychological conditions as scientific consideration of hypnosis?
I'm to respond?
Yeah, like the various psychological condition and hypnosis as evidence-based practice.
Yes.
Any idea on that?
So in general, I think whatever is of psychogenic origin, hypnosis should help. And when you specifically ask for the scientific evidence, certainly it is anxiety disorders and phobias where it can help. And I personally feel that hypnosis has more wider applications in the area of psychosomatic disorders. These are
In
the
trauma, in
good
psychological
candidates
trauma,
for psychological trauma. Also, that I said in general that any condition which has psychogenic origin, it can certainly help. Trauma releasement is very good. It can be done through hypnosis under trance state and regression. Trauma releasement work exceedingly well. Yes, it's very good. And
if you
also,
look at the yes.
I think that there are many conditions we have not yet generated the stronger evidence, but it certainly works. That is your negative emotions, relationship problems, then even your sleep-related problems, quality of life, well-being. We are yet to generate evidence in the field, but the hypnosis can contribute significantly in countless conditions.
Systematic review and meta-analysis and various RCTs, there are proven evidences
Yes.
for pain disorders,
Pain
for IBS, even for asthma and other psychosomatic condition and habit disorders, and on psychological issues, mild to moderate depressive disorders and anxiety disorders there, and as well as post-traumatic stress.
The upcoming approach of cognitive hypnotherapy will lead to generation of more evidence, stronger scientific evidence in due course.
And also sleep disorders, there are now evidences.
Yes.
And infertility, in the management of infertility also now there are stronger evidences. So we are coming to the last section of today's panel discussion. So despite having evidences, despite having many evidences, many clinicians are still hesitant to use hypnosis. So they might not have much of the misconceptions, but still they are hesitant to use hypnosis. So what might be preventing their wider acceptance of hypnosis? So Dr. Puri, if you can share your experience on this.
Yeah. So fortunately, the people I work around, and many psychiatrists also from AIMS Delhi and other places. I'm based in Delhi, Gurgaon. So people are very open to hypnosis and hypnotherapy, and many psychiatrists have been doing their own degrees and diplomas or certification courses. So most of them have done it, and that is how we speak about it. They are open about it. Slowly, people are understanding the importance of hypnotherapy, and mostly we are using hypnotherapy. The kind of cases like I specialize in narcissistic abuse recovery. So basically, narcissistic abuse recovery के लिए for the victims of the family, the victims who are there, and people all ages, both genders across continents, they are suffering and suffering very badly. Like yesterday, there was this case where this fellow said that I want to, bring my mother also online so that she also gives her perspective. Now, this fellow has been married for, let's say, 15 years, has two kids, teenage um, approaching kids, and the wife is beating up husband regularly and doing all sort of narcissistic abuse which we can think of. She's also beating up the mother. So the mother-in-law here, the mother has been sent to the sister's place, and this wife, after so many years, he asked her brother to come and take her away forcibly because she didn't want to leave, and so many other kind of abuse, financial, emotional, social, physical. We are facing the army officers, the police officers, And the administrative people in senior positions in administration, corporates, we are talking of people at the GM levels and all of that, are suffering this physical abuse, men. And most of my videos on YouTube talk about men only because we keep getting, it's not that women ka nahi ho raha, but the kind of, and many times mothers of men, they are connecting. Now here, the relationship management and how to enhance. I'm sure बातों से psychotherapy will connect with only 10% of the mind. Your 10% of mind, my 10%. Hypnotherapy and deeper levels of therapeutic interventions will connect with the subconscious levels, and how to one delete the trauma which they have suffered all these years and the family. So relationship issues and grief therapy, especially in this case, and they are into it and they are not, and trauma, they trauma bonded, they are so much trauma bonded in their life with this person that they have been suffering and they still want to continue to suffer कि अगर मैं भी suffer करके मेरे बच्चे ठीक हो जाते रहते हैं, it's not going to happen, we know that. But that is how they sometimes say कि डॉक्टर आप ये मत बोलो कि डिवोर्स लेना है, सेपरेशन लेना है, but आप you just help me. And I'm talking of again senior people in senior positions across continents. और वो कार में बैठ के बात कर रहे हैं क्योंकि घर में नहीं कर सकते, ऑफिस में नहीं कर सकते, एंड दे आर हैविंग दैट सेशंस, डिफरेंट टाइम जोन्स फ्रॉम डिफरेंट कंट्रीज, इंडिया इंक्लूडिंग. So now in such cases, you have to again the developing that where they feel safe to talk about, and then get into trance state also, because once they are calm, the calmness happens. Then they feel the empowering suggestions and other things are fed in slowly, and the abuse of so many years, it cannot be taken in one go, but slowly, slowly, at least they start. People who have been facing abuse for 20 years, women including also. So 20 years, more than 20, 40 years also. So relationship management, empowering in relationships, developing, learning to develop their boundaries. And we have written a book also on this, boundary enhancement therapy belt.
So you want to mean that whatever the experiences we are having, whatever the evidences that we are gathering on
So
the cases, or if we share on those cases, those knowledges at various platform, like various seminars, conferences, probably that will be more helpful in terms of
And
acceptance.
many of my students are doing their PhD on the subject in hypnotherapy in
That would
relationships,
also help.
especially
That also.
managing
Thank
NPD, the toxic relationships.
you. So where do you see hypnosis 20 years from now, Dayal sir?
The one thing is that I'd just like to say, most doctors are interested, but when they get busy, they don't have the time. So when you do short, brief 10-minute sessions, 15-minute sessions, they might be able to do it with a few patients. But if they've been able to do that later, then when they identify patients, they can send them to hypnotherapists who practices only hypnotherapy. That's one. Number two is lots of apps are coming up. David Spiegel has one, IBS pain, whole lot of things. There are sleep apps using hypnosis. There are hundreds of YouTube videos shared by lay and trained hypnotherapists. So, but I see AI as the next frontier. One of the frontiers is AI, and the other is psychedelic therapy combined with. We know now that lots of severe depressive disorders, resistant depression, chronic pain conditions, cluster headaches, which don't respond to most of the treatments, including hypnosis, have responded well to ketamine plus hypnotherapy, or even so I see that as one frontier, preparing patients for psychedelic therapy. In psychedelic therapy, if the person is getting very disturbed, you can use if they've already been trained, you can, using post-hypnotic suggestion, induce the trance and get them out of that, switch it to a more positive experience. And the third thing is integrating the knowledge they gain from that. So that's one area which I think already people are working. Hypnodelic therapy was known in the 60s also till LSD was banned. Number two is I see a lot of, like Elvira Lang's work where general doctors are being taught these short techniques or short methods. And then in birth and all, there's a huge demand for that because, and she's also teaching people, like is to learn self-hypnosis that when they're in a medical emergency or when they're in chronic pain, they already have the self-knowledge and ability to go into a trance and deal with that less upset, less, more resourceful, less pain. So these are some of the areas I feel where it's spreading in the West. I don't see that happening too well in India.
So where do you see hypnosis 20 years from now?
It depends on the next group of people who propagate hypnosis among healing professionals. And, hypnosis, if you looked at the Dewey system of books, when they are kept in the library, you will find it's in the occult section, not in the science section. We need to be able to move it there for medical professionals, even for psychologists to be able to adopt it. Because they don't want to, their professional identity doesn't allow them to do something which are seen as occult. However much we might believe in it, we have to recognize where they are coming.
Jain sir, if hypnosis is to become more mainstream in India, what needs to change?
Yes, it is. I think what the responsibility it is on us. Whatever scientific platforms, conferences, seminars in the field of mental health, psychology, we should come forward and present hardcore evidence and our cases as presentations, workshops, symposium. I think we should make it a resolve that in most of the conferences we shall represent this modality of treatment. So I think that with that knowledge, there will be more acceptance, more practitioners will come forward and they'll learn hypnotherapy. So I feel that this lack of knowledge, proper training, and the misconceptions around hypnosis, these are present in scientific community also. We need to eradicate through our proactive efforts. So if we can move in that direction, I think we'll be in a better position. But as on date, I think that we are still laying the foundation of hypnotherapy in our country, and we have to enrich it, grow it, nurture it, so it can take up.
I see that a good number of hypnotherapists, they are not into academics, they are into professional practice. And the problem is people who are in professional practice, they do not participate in conferences or seminars most often, other than the mainstream conference and seminar. So if we also can prepare our case studies and present on those conferences and seminars, probably that will be quite engaging. Like I can remember, I probably presented one of the case studies on chronic pain management in a pain conference. And the next year, whenever that international pain conference happened, they invited me to present a workshop, 2 hours workshop on hypnosis, and it was attended by around 49 pain medicine specialists. And this year also, this September, they are having the conference. They want a half-day workshop on this. So once we start presenting our work in a scientific way, probably there is a higher acceptance. People do not know about the subject. That is one issue. They are having misconception. And once we do it bit more experiential, just 10 minutes of demonstration, how hypnotic experiences can happen, sometimes that can be quite helpful, illuminating for them also, so that we can see. So in one sentence,
Yes,
yes.
that is what I also wanted to say, that we need to start interacting with different medical fields like anesthetists, like physicians and pediatricians. So if we associate with them, and like we had before, I think last year or before that, with gynecologists and obstetrician. So joint work with those other branches, that can really motivate medical people.
Yes, sir.
Sorry for interruption,
Well said.
please.
Well said.
Yeah, all doctors have to now do 30 hours or so. It's about 60 hours between every 5 years of CME points. And these are organized mainly by the IMA and others. So if one writes to the different branch, they are in Bombay, for example, there are 5-6 branches: Bombay, Central, West, East. So that's one place where you can give demonstrations or even teach stress management for the doctors there. Similarly, Lions. I've been Rotary. I've been invited number of times where I'd give a small talk and then give a short demonstration also, or a group demonstration. So those kind of things will expand the reach, and also training for doctors don't have time. Like Elman, I don't know if you know, but he was a lay hypnotherapist who only taught doctors, and he would teach them how to do an induction in 4 minutes and do a session in 20 minutes. So that some doctors were able to incorporate into their medical practice. So if we can, create specialized courses for certain professionals, it would help. Like.
Yes, sir. So what ethical responsibilities become even more important when practicing hypnosis? Palan,
One
sir.
is sorry.
Yeah, well, sir. Yes, sir. Yes, sir. You can
One
begin.
is to know how to recognize the contraindication. So anyone who has a psychotic disorder, who's paranoid, unless you have specialized treatment in treating those conditions, you should not touch.
Palan, sir, would like to add anything?
Same. What Dr. Dayal told, paranoid psychosis especially, or very severe depression with active suicidal ideation, we should not be doing. And whenever we take any other psychiatric condition, I believe that it should be in liaison with the treating psychiatrist and with your experience only.
So I'll go for a final rapid fire to all the panelists. You have to give your responses one sentence.
You spare me from that, please.
No. One myth about hypnosis you wish would disappear forever. Anyone? One myth about hypnosis you wish would disappear forever.
Vashikaran.
Okay. One area where hypnosis is underutilized.
All areas, not specific in psychiatric disorders, psychosomatic disorders, it is underutilized still.
Okay. And the final question, one message for young psychologists and medical professionals interested in learning hypnosis.
Learn through structured programs, proper supervised training program, and read authentic work like Milton Erickson and all scientific evidence, and know the nature of hypnosis, nature of mind, and the nature of condition in which you intend to treat, intend to intervene. You must have a comprehensive knowledge skill, and only we should venture into it. If you miss
Dr.
any point,
Dayal?
then we can.
I would suggest to start with simpler, and no problem is simple, but things which are easier to. You start with being able to, if you can treat, say, smoking and get good results, maybe 40% results, 30% results. So you start with those kind of things, and then build your skills, and then start dealing with more complex psychosomatic, or there are less chances of anything going.
Dr. Palan?
Yes, we advise to learn from authentic courses. That is very essential because many people, and we need to work for that actually. We need to create we have started creating AoH PD diploma course, and we are thinking of associating with different universities. So if we approach different universities to start maybe 1 year or 6 months or 3 months, but good course, academic course, then I think that can help younger generation to pick it up.
Dr. Puri?
Yes, learning through structured programs is very, very important. And as Dr. Pralan said, that yes, if we diversify to various areas pan India, and maybe short term 3, 6, 9 months, something like that to begin with authentic teachers and authentic learning, serious learning. So that will really be useful because there are so many people out there who don't know where to go, who actually are students that do not know where to go. And there are so many limitations they also have. So if this kind of thing, if it can be, if this kind of thing happens, then it's going to benefit a lot of budding mental health professionals.
Okay. The last question, if James Braid, Milton Erickson, and an ancient Indian yogi were sitting together today, what do you think they would agree upon and what would they disagree about? Anyone?
Intention is important. Intention to change. Formal intentions.
Okay.
I suggest that you put someone in a trance and have them visualize the three of them having a conversation, and then come with a
Ericksonian
transcript
way.
of that.
Ericksonian way. I tried something like this. This PDDC is telling something. Dr. Rakesh Jain I took. So it was like taking Erickson to Swami. that happened. So, but they had no much opportunity or time to interact with each other. But yes, the distance need reduction between clinicians clinic and
Okay. Thank you. Thank you.
One thing I'd
Yes,
like to
yes,
add,
yes.
the use of hypnosis in schools is, not there. And that's a fertile place too, because we see so many students with psychosomatic illnesses, exam, backaches, neck aches, exam phobias, and severe, and then post the exams, if the results don't come, the thing. All these things can possibly be prevented in some way. So if someone were to develop a module and training for that, and
that's a
it's
very
not
good
necessary,
idea. Yeah.
and it's not necessary that even teachers can do it under supervision of psychologists, and they're not the primary therapists, but they're helping with
Yeah. So coming out with short modules, small modules for students, for sports people. Nowadays, sports also is picking up in our country. So helping sports enthusiasts or helping executives or even teachers in managing stress. So several schools I have done workshops for a short workshop, 1 day workshop for teachers. So these kind of thing. And I believe that yes, some not psychologists, but some people who are interested, they can be trained by us, by some good organization, and they can then spread. So there can be, Dr. Dayal, like if you are aware, Dr. Stanton started that kind of movement in those days, 80s in Australia. And there was a national mental training program which he introduced in the schools. So all the children in like middle school and high school, and then in the college, they were trained in doing self-hypnosis. So this kind of training, which can be adopted by the governments, schools, I think that this can help.
That's a good idea.
Prevention.
And that would be
Prevention.
called self-hypnosis trainers rather than
Right,
hypnotherapy.
self-hypnosis training. Dr. Stanton, I had interaction with him in a conference also and later on also. But those days were it was very early for
Yeah,
these kind of things in India, 80s and 90s. But now is the time when we can initiate something like that.
and the net has changed it.
Hmm.
So it's more possible to do these things.
Yeah.
Students are also available on the net.
Yes.
Thank you all the panelists for giving it a long time. We had a discussion for almost 1.5 hours. And thank you for your input. And probably this will help us to integrate something and plan for the future. And thank you. Over to Nivedita.
Thank you, Dr. Prasanta, sir, for making the discussion so interesting. And it was really, really a great learning. So I thank all the panelists. And as we approach the conclusion of today's celebration, I would request Dr. Prasanta, sir, to make an important announcement regarding our upcoming conference in 2027.
Okay. And this is about the next conference, next international conference, and that we are planning in 2027. And I had a talk with my Institute of Psychiatry, Kolkata, and they have agreed to host this conference in Kolkata next year, maybe most probably February 2027. We'll be planning it. We are having a meeting. We'll be notifying soon about it, and needs all the support from the members and non-members of Academy of Hypnosis to make it a more interesting scientific conference and also meeting of the like-minded people. Thank you.
So once again, I request you to deliver the vote of thanks. Prashant.
It's just a formality. So thank you. I'll begin with Nivedita only because she had to take this charge at the very last moment. It's very stressful. And Nidhi was supposed to take this responsibility, but tomorrow she is having her PhD presentation. So, and there are last minute changes, and unfortunately, I'm her co-guide. I suggested some last minute changes, and that she had to make. Uh, and I'd like to thank all the invited professionals, Dr. Dayal Mirchandani sir, Madam Amita Puri, and all the AoH executive members, Dr. Palan sir and Dr. Jain sir, Dr. Prapanna, Dr. Dave is also present, and also other the enthusiasts and the members of Academy of Hypnosis who would like to explore hypnosis as a clinical discipline, as a scientific discipline. So thank you all for your time on this weekend, and wish you a happy weekdays ahead. Thank you.
Thank you.
Thank you, everyone. Thank you. Take care.
Thank you. Thank you.